Chronic Gastritis Endoscopy. The importance of endoscopy in diagnosing chronic gastritis. Health 365. Today. Chronic gastritis is something many people deal with, but it's often overlooked until the symptoms become too hard to ignore. Let's talk about it today. So, what exactly is chronic gastritis? Well, it's a long-term inflammation of the stomach lining. And while we all know our stomachs can be a bit sensitive now and then, this condition is more persistent, lingering for months or even years. So, how does it happen? There are a few common causes, but the one I want to highlight is something we've all probably heard of: H. pylori bacteria. This little troublemaker is responsible for many cases of chronic gastritis. It can sneak into the stomach and start causing damage, leading to that uncomfortable burning sensation or bloating you might have experienced after a meal. And it's not just the bacteria. Long-term use of NSAIDs, like ibuprofen, or drinking too much alcohol can also increase your risk. These substances can irritate your stomach lining over time, making it vulnerable to inflammation. Now, for some people, chronic gastritis can even be linked to autoimmune conditions. In these cases, your own immune system mistakenly attacks the stomach lining, making the inflammation even worse. Imagine your body, which is supposed to protect you, causing harm instead. That's the reality of autoimmune gastritis. So, what are the signs? Well, let's start with the obvious. Stomach pain. That nagging, crampy feeling that never seems to go away. You might also feel bloated or nauseous, and indigestion becomes more frequent. Oh, and let's not forget the loss of appetite. When eating becomes uncomfortable, it's no surprise that you might just want to skip that meal. As a doctor, I've seen how these symptoms can disrupt someone's life. It's not just about discomfort. It's about how chronic gastritis can impact your day-to-day routine. From the moment you wake up to the moment you go to sleep, this condition can weigh on you. And if left untreated, it can lead to more serious issues like ulcers or even stomach cancer. That's why it's important to pay attention to the signs and seek treatment. If you're ever in doubt about your symptoms, a chronic gastritis endoscopy is one of the best ways to get a clear picture of what's going on inside. It's a simple procedure, really. A small camera is inserted into your stomach through your throat to take a look at the lining and see if there's any inflammation or damage. It's a quick and effective way to confirm a diagnosis and start you on the path to recovery. So, what can we do about it? First, it's all about health awareness. Understanding what's happening inside your body and taking steps to address the underlying causes, whether it's managing stress, adjusting your diet, or perhaps taking a break from those pain medications. With the right care, chronic gastritis doesn't have to be a lifelong sentence. 2. The importance of endoscopy in diagnosing chronic gastritis. When it comes to chronic gastritis, one of the most important and essential methods for an accurate diagnosis is an endoscopy. Have you ever wondered why you need to undergo an endoscopy? Let me explain. An endoscopy is a medical procedure where a doctor inserts a long, thin tube with a camera into your stomach through your mouth. This tube allows the doctor to clearly see the stomach lining and detect any abnormal signs that other tests might miss. And this is exactly why an endoscopy is so important in diagnosing chronic gastritis. Imagine that inside your body, your stomach is inflamed, and there might even be ulcers. But how can you know for sure if it's just the usual stomach ache or discomfort? An endoscopy lets us see these damages up close, determine the level of inflammation, and identify other potential issues. This is crucial because it not only helps diagnose chronic gastritis, but also helps us spot more serious problems, like stomach cancer. But it doesn't stop at just seeing the damage. An endoscopy also allows the doctor to take tissue samples from the stomach lining for a biopsy. This ensures an accurate diagnosis because sometimes gastritis can have other factors involved, and we need to make sure there are no signs of other diseases. From my own experience, I've seen many patients come in with discomfort and stomach pain, but only after an endoscopy can we clearly identify the cause and determine the right course of treatment. Sometimes an endoscopy is all you need to rule out other serious conditions and help put your mind at ease. I also want to stress that a gastric endoscopy isn't a scary procedure, and it can actually help you feel more at ease knowing exactly what's going on with your health. If you're dealing with symptoms like persistent stomach pain, nausea, or indigestion with no clear cause, consider getting an endoscopy to get some clear answers. Finally, I want you to always remember that awareness and understanding of your health are incredibly important. Health awareness doesn't just help you catch problems early, it also helps you handle them more effectively. And if you suspect you might have chronic gastritis, don't hesitate to discuss with your doctor about having a chronic gastritis endoscopy. It will help protect your stomach health for the long term. 3. The endoscopy process for chronic gastritis. Let's talk about the process of a gastric endoscopy, especially when it comes to diagnosing chronic gastritis. If you're about to undergo this procedure, I know it can seem a bit intimidating, but I promise, it's a lot simpler than you might think, and it's incredibly valuable for your health. First things first, you'll need to prepare. One of the main things you'll be asked to do is fast before the procedure. This means no food or drink for several hours before the endoscopy. The reason for this is simple. Having an empty stomach ensures that the doctor can clearly see the lining of your stomach without anything getting in the way. It might feel a little uncomfortable, but it's essential for the best results. Now, let's talk about how the procedure itself will go. You'll be given a local anesthetic, or sometimes a mild sedative. This is to make sure you're comfortable. The sedative might make you feel a little drowsy, so you won't be fully awake during the procedure, but you'll be relaxed. If you're a bit nervous, don't worry. This part is totally normal and helps you feel at ease. During the actual endoscopy, the doctor will insert a long, flexible tube with a camera on the end through your mouth and into your stomach. You may feel a bit of discomfort here, but it's quick, and the camera allows the doctor to clearly see the lining of your stomach. They're looking for signs of chronic gastritis, ulcers, or any other abnormalities that might be causing your symptoms. It's an excellent tool for making a precise diagnosis. Now, after the procedure, you might feel a little bloated or uncomfortable. Don't be alarmed. This is typical and will go away soon. You might also have a sore throat from the tube, but that should pass within a few hours. The good news is that you'll likely be able to go home the same day, and recovery is quick. As a doctor, I've seen how crucial this step is for diagnosing chronic gastritis. A chronic gastritis endoscopy gives you clear answers, allowing you to move forward with a treatment plan that's right for you. In fact, it can help rule out other more serious conditions, like stomach cancer, giving you peace of mind. And remember, the most important thing is health awareness. If you're dealing with symptoms like constant stomach pain, bloating, or nausea, an endoscopy might be exactly what you need to take control of your health. It's a safe, straightforward procedure that helps ensure you get the proper care and treatment you need for your stomach health. 4. Findings through endoscopy in chronic gastritis. When it comes to diagnosing chronic gastritis, an endoscopy can reveal a lot more than just a simple look inside your stomach. If you've ever had one, or if you're considering it, let me walk you through what doctors are really looking for during the procedure and why it's so important for your health. So, what can we actually see during an endoscopy if someone has chronic gastritis? First off, one of the most obvious signs we look for is inflammation. You might be familiar with that burning feeling in your stomach, but an endoscopy allows us to actually see the redness and irritation of the stomach lining. This is often one of the earliest signs of gastritis, and it can help us understand just how severe the condition is. Another key thing we look for are ulcers. These can show up as small, open sores on the stomach lining. They're often painful, and they're a common result of chronic inflammation. In fact, ulcers and gastritis are often linked. So if you're experiencing those sharp stomach pains, it's possible an ulcer could be part of the picture. We also look for something called atrophy, which is a thinning of the stomach lining. Over time, with chronic irritation, the stomach lining can start to shrink and become weaker. This is a more advanced sign of gastritis, and it's something we pay close attention to during the endoscopy. Atrophy can indicate that the damage is becoming more serious, and that's why it's crucial for your doctor to see this in person. Now, one of the most important things we're hoping to find, or not find, is the presence of H. pylori bacteria. This little bug is often behind chronic gastritis, and an endoscopy is one of the best ways to see if it's causing your symptoms. Sometimes we can even take a small sample of the tissue, a biopsy, to test for this bacteria more precisely. Speaking of biopsies, they're actually one of the most crucial parts of this whole process. It's not just about looking inside, it's about confirming the diagnosis. By taking a sample of the stomach lining, we can check for other conditions that might mimic gastritis, such as stomach cancer. This is why a chronic gastritis endoscopy is so much more than just a checkup. It's a tool that helps us rule out serious conditions and ensure that we're treating the right thing. From my experience, I've seen how vital this procedure is for getting to the bottom of stomach issues. Without an endoscopy, it's hard to know exactly what's going on inside. But once we have a clear picture, we can move forward with a treatment plan that's tailored to you, whether that's antibiotics for an infection or medication to heal your stomach lining. So, if you're struggling with chronic stomach pain, bloating, or nausea, and you haven't had an endoscopy yet, this might be the next step. It's an essential tool for understanding your condition and ensuring that you're on the right path to recovery. And remember, health awareness is key. The more you know, the better equipped you are to take charge of your health. So don't hesitate to ask your doctor about a chronic gastritis endoscopy if you're experiencing persistent symptoms. It could make all the difference. 5. Treatment and management. After endoscopy. After you've had your chronic gastritis endoscopy and we've confirmed the diagnosis, the next important step is figuring out the right treatment and management plan. I want to walk you through what you can expect moving forward, because this part is crucial for your recovery and long-term health. First, let's talk about medications. One of the most common treatments for gastritis involves proton pump inhibitors, PPIs. These are medications that help reduce the acid in your stomach, giving the lining a chance to heal. In some cases, H2 blockers might be prescribed, which also help reduce stomach acid, though they work a bit differently. These medications are key to easing the symptoms and preventing further damage to the stomach lining. But it's not just about acid control. If your gastritis is caused by H. pylori, that bacteria that's often the culprit behind chronic gastritis, you'll likely be prescribed antibiotics. This is a big part of treatment because clearing out the infection can actually help the stomach heal and reduce inflammation over time. Now, let's talk about something that's just as important as medication: your lifestyle. Managing stress and making changes to your diet are essential for both short-term relief and long-term health. I always tell my patients that managing stress is key, whether it's through relaxation techniques, exercise, or even just taking time each day to unwind. It's amazing how much stress can contribute to stomach issues, and by managing it better, you can really help ease some of those symptoms. Diet is another huge factor. You'll want to avoid foods that can irritate your stomach, like spicy foods, acidic foods, or anything too greasy. Instead, focus on eating smaller, more frequent meals, and try to incorporate soothing foods that are gentle on your stomach, like oatmeal, bananas, and non-citrus fruits. Also, it's a good idea to avoid alcohol and NSAIDs, those over-the-counter pain relievers that can worsen gastritis. And after all of that, regular follow-up care is key. It's not just about taking your medication and hoping for the best. Long-term management means keeping track of your symptoms and having regular check-ins with your doctor to make sure everything is healing as it should. Sometimes, another endoscopy or even just a blood test is needed to see how things are progressing. From my experience, treating chronic gastritis is really about balance. Balancing the right medications, lifestyle changes, and ongoing care. It's not a one-size-fits-all approach, and every patient's journey is a bit different. But with the right treatment plan and a little patience, you can definitely feel better and manage the condition in a way that works for you. Remember, Health 365 is key. Understanding your condition and the steps you can take to improve it is empowering. So, if you're dealing with chronic gastritis, don't wait to seek help. Work with your doctor to find the treatment plan that's right for you, and always follow through with those lifestyle changes. Taking charge of your health is the best way to ensure a happy, healthy future. 6. Conclusion. Summary of the role of endoscopy in diagnosing chronic gastritis. As we wrap up today's discussion, let's take a moment to reflect on the key points. If there's one thing I want you to take away from this video, it's the importance of chronic gastritis endoscopy in diagnosing chronic gastritis. This procedure is invaluable because it allows us to actually see what's happening inside your stomach. It's not just about symptoms. It's about understanding the root cause of those symptoms, whether it's inflammation, ulcers, or something else entirely. The clarity that an endoscopy provides is unmatched, and it's a crucial step in accurately diagnosing and treating this condition. But it's not just about knowing what's wrong. It's about what you do with that information. The earlier we detect and treat chronic gastritis, the better the outcomes. Early detection helps us manage symptoms more effectively, prevent complications like ulcers or even stomach cancer, and improve your overall quality of life. Chronic gastritis may feel like a minor issue, but left unchecked, it can lead to some serious health problems down the road. That's why it's so important to take action as soon as you start experiencing symptoms like persistent stomach pain, bloating, or nausea. As a doctor, I encourage anyone who's dealing with these symptoms to seek medical care. Don't wait until things get worse. Health 365 is all about taking control of your health before things spiral out of hand. The sooner you get checked out, the sooner we can figure out what's going on and help you feel better. Remember, getting an endoscopy when needed could save you from future complications, so never hesitate to reach out to your healthcare provider if you're concerned. In the end, managing chronic gastritis is about being proactive, making the right lifestyle choices, and staying on top of your health. If you've been struggling with stomach issues, take the first step toward feeling better by talking to your doctor and exploring the best treatment options for you. The more informed you are, the better equipped you'll be to handle whatever comes your way.